The 2014-2016 West African Ebola outbreak, the largest recorded, exposed significant vulnerabilities in regional and global public health responses. It began with a young boy in Guinea, who was initially believed to have contracted the Ebola virus from an infected bat. As Ebola can be transmitted through direct contact with the bodily fluids of an infected person or contaminated materials, the close-knit community and family interactions facilitated the initial spread of the virus. Once the virus entered the human population, it quickly took advantage of the porous borders and frequent travel between communities in Guinea, Liberia, and Sierra Leone. The region's healthcare infrastructure was ill-prepared for an outbreak of this magnitude. Hospitals and health centers were under-resourced, lacking adequate medical staff, equipment, and the necessary infrastructure to handle a highly infectious disease like Ebola. This inadequate preparation was compounded by traditional burial practices that involve direct contact with the deceased, significantly increasing the risk of transmission among communities. Additionally, the outbreak's spread was exacerbated by a slow initial response, both locally and internationally. This delay was crucial, allowing the virus to spread rapidly and extensively before significant interventions could be implemented. Misinformation and lack of awareness about how the disease was transmitted also played a role. Many communities were initially unaware of the risks and prevention methods for Ebola, and widespread misinformation led to mistrust in health workers and public health directives, which further hindered containment efforts. The overwhelming number of infections and the high fatality rate were also due to the lack of protective gear and isolation units in hospitals. Many health workers contracted the virus, leading to a further reduction in healthcare capacity and an increase in transmission rates. The outbreak highlighted the critical need for international cooperation in health emergencies, rapid response strategies, effective communication to counteract misinformation, and stronger healthcare systems to prevent and mitigate future pandemics. The West African Ebola outbreak from 2014 to 2016 was unprecedented in its scale, marking the deadliest occurrence since the virus was first discovered. It mainly afflicted 3 countries, Guinea, Liberia, and Sierra Leone. The virus infected over 28,600 individuals, leading to more than 11,300 deaths. These figures not only reflect the virulence of the Ebola virus but also underscore the extensive challenge faced by the health systems in these countries, which were not equipped to handle an outbreak of this magnitude. The epidemic devastated the healthcare infrastructure in the affected regions, already vulnerable due to insufficient funding and resources. The outbreak further strained these systems, leading to a breakdown in routine healthcare services, which increased mortality from other common diseases. The economic impact was also profound, with the World Bank estimating significant losses in GDP for the affected countries, hampering economic growth and development. The tragedy of the Ebola outbreak highlighted several areas where effective intervention could prevent or mitigate future outbreaks. Strengthening healthcare infrastructure is critical. This includes not only improving facilities and supplies but also training healthcare workers to manage infectious diseases effectively. Quick identification and isolation of cases, efficient contact tracing, and vigilant monitoring are vital to control the spread of the disease. Public education plays a crucial role in managing outbreaks. Informing communities about the symptoms of Ebola and how it spreads can empower individuals to seek help early and follow public health advice, reducing the disease's spread. Moreover, clear, transparent, and timely communication from health authorities can help minimize misinformation and panic. International cooperation is essential for managing health crises that have the potential to cross borders. Support from global health institutions and wealthier nations can provide the necessary resources and expertise to contain outbreaks in regions with limited local healthcare capabilities. Ongoing research and development into medical treatments and vaccines are also crucial. The development and deployment of the RVSV-ZEBOV vaccine during and after the West African Ebola outbreak have shown how scientific advancements can turn the tide against such diseases. Lastly, understanding and integrating cultural practices in the management of health crises are essential for any intervention to be successful. Local customs, especially those related to burial practices and caregiving, need to be respected and, if necessary, safely adapted to prevent disease transmission. Engaging with community leaders to endorse and disseminate health interventions ensures that measures are culturally appropriate and more likely to be effective. The West African Ebola outbreak was a stark reminder of the global nature of health threats and the importance of readiness and resilience in health systems worldwide. The West African Ebola virus outbreak of 2014-2016, which was officially declared over in June 2016 by the World Health Organization, WHO, marked a significant crisis in public health. The end of the outbreak was a relief, but the affected regions remain vigilant against the potential threat of new outbreaks due to the virus's presence in animal reservoirs, particularly in fruit bats, which can transmit the virus to humans under certain conditions. Preventing future Ebola outbreaks in regions vulnerable to the virus involves a comprehensive and multifaceted approach, focusing primarily on enhancing public health capabilities and community awareness. Effective surveillance and rapid response systems are crucial. These systems need to be capable of quickly detecting and isolating cases to prevent the spread of the virus. Training healthcare workers to recognize the symptoms of Ebola and respond appropriately is essential for these systems to function effectively. Community education plays a pivotal role in prevention efforts. Public health messages need to clearly communicate the symptoms of Ebola and the importance of seeking medical help promptly. Additionally, addressing local customs and practices, especially those involving the handling of the deceased, can help minimize risky behaviors that contribute to the spread of the disease. Strengthening the healthcare infrastructure is another critical element. This includes ensuring that healthcare facilities are well equipped with the necessary supplies and isolation units and that staff are trained to handle outbreaks safely and effectively. Moreover, the availability and accessibility of the Ebola vaccine, such as RVSV-ZEBOV, are vital for protecting at-risk populations, especially healthcare workers and those in close contact with infected individuals. International cooperation is also fundamental to Ebola prevention. Outbreaks require coordinated responses that can mobilize international resources and expertise quickly to support affected regions. This cooperation extends to ongoing research and development, which is crucial for improving understanding of the virus and developing effective treatments and preventive measures. By integrating these strategies, regions at risk of Ebola can improve their preparedness and response capabilities, significantly reducing the likelihood and potential impact of future outbreaks.